Are you able to understand the concept or not? Memorizing is a later on affair. Okay? Fine. Chalo. नहीं उसको नहीं करना. Is this on? Hello, hello. Hello, hello. Hello, hello. Chalo guys, let's go forward now. Uh, did you have any question in the chat box? Let me see that. Welcome back. After the hemorrhages, let us do the next topic. Now, there are a couple of questions possible. First of all, see this next picture now. Whitish membrane on tonsil. Whitish membrane on tonsil, very common thing. Whitish membrane on tonsil. A lot of time we get this whitish picture on the membrane on the tonsil. What are the various causes of that? Let's do that now. Number one is acute membranous tonsillitis. Acute membranous tonsillitis, first of all, it is the most common cause. Acute membranous tonsillitis is the most common cause. Most common cause, and it is caused by, right? It is caused by Streptococcus pyogenes. Streptococcus pyogenes, beta. It is caused by Streptococcus pyogenes, beta. Streptococcus pyogenes, beta. Okay. The most common cause of the membranous tonsillitis or the tonsillitis in general, which we see in the clinical practice, the whitish membrane on tonsil will be actually most commonly due to acute membranous tonsillitis caused by Strep pyogenes. Number two, infectious mononucleosis caused by Epstein-Barr virus, EB virus. EB virus. Okay. Number three, diphtheria. Now, diphtheria is important, beta. Diphtheria. Everybody, write on the sidebar, diphtheria. What are things to be looked for diphtheria, beta? Diphtheria. How to really, conceptualize diphtheria for the ENT questions? Diphtheria, first of all, is a sick baby with fever, with bull neck. Sick baby with fever with bull neck. What is bull neck in the bracket? Cervical lymphadenopathy. In diphtheria, there are big lymph node in the neck, and literature says that as bull neck, beta. Bull neck means cervical lymphadenopathy. How the question of diphtheria would be picked up in pediatrics or ENT? Sick baby with fever with bull neck. And now two things can be there, beta. Two things. Two questions can come in ENT out of diphtheria. Sick baby with fever with bull neck. What is bull neck? Bull neck is cervical lymphadenopathy. Two questions can come in this. Number one, if you remember, unilateral vocal cord palsy. Try to recall the larynx topic, beta. Diphtheria can be cause of unilateral vocal cord palsy. Unilateral vocal cord palsy, beta. Okay, unilateral vocal cord palsy, and the treatment is conservative. Treatment is conservative. I know there are couple of questions in the chat. I will take it little later after this topic. Treatment is conservative, beta. Okay, and then this is MCQ, beta. We have discussed this already, beta. In larynx topic, we said that unilateral cord palsies are to be treated conservatively. The second one is membrane over tonsil. Membrane over tonsil. Membrane over tonsil extending to palate, beta. Extending to palate. This is the biggest clue, beta. Membrane over tonsil extending to palate. Put an arrow. And this membrane bleeds on removal, beta. Last year question. Bleeds on removal. This membrane bleeds on removal. The membrane of the diphtheria is on the tonsil extending to palate and it bleeds on removal. It bleeds on removal, beta. Bleeds on removal, beta. It bleeds on removal. Okay. Okay, fine. You say, Rajiv, where is the diphtheria membrane? Can you see the diphtheria membrane, beta? Can you see diphtheria membrane is extending from tonsil to palate, beta? I think it's very clear in this picture also. The membrane of diphtheria is extending from tonsil towards the palate, and once you remove it, there'll be bleeding on removal, beta. So 2 points to remember about diphtheria membrane. Number 1, it extends from tonsil to palate, and number 2, when you remove it, there's a bleeding over there. So diphtheria has got clinical scenario: sick baby with fever, with bull neck, and 2 questions possible in ENT. One is unilateral vocal cord paralysis. For that, the treatment is conservative. Second is membrane question. The membrane of diphtheria extends from tonsil to palate and it bleeds on removal, beta. This is what you need to do. Okay? Okay. Then what are other causes, beta? Diphtheria done. Diphtheria. Then candidiasis. Candidiasis, beta. Then Vincent angina. Malignancy of tonsil. Leukemia. Leukemia. Leukemia, beta. Once again, let us revise the various causes of whitish membrane on tonsil, beta. Speak with me, beta. Speak with me. The whitish membrane on tonsil, the most common cause is number 1. Bolo, beta, bolo. Number 1, acute membranous tonsillitis caused by Streptococcus pyogenes is the most common cause. Number 2, infectious mononucleosis, which is caused by Epstein-Barr, EB virus, beta. The third is very important, diphtheria. Diphtheria, the 2 points to remember is, number 1, the membrane extends beyond tonsil to the palate. Number 2, it bleeds on removal. Number 4 will be candidiasis. Number 5, Vincent angina. Number 6, malignancy of tonsil. Number 7, leukemia. Leukemia, beta. Okay? All these points are clear, beta? Now, before we go to the next topic, Walder ring, let me take a few questions, beta. Let me take a few questions. It means it will be clear, so we can use it. Srinivas Manikanta says that that yes, it is due to bacterial infection. Mild bleeding means that the infected area is bleeding, so that's why you need Srinivasa. We need antibiotic for that, beta. Lakshmi Narayan, if the bleeding would have been on Tuesday, then of course it is reactionary hemorrhage, beta. If the bleeding is within 24 hours, it is actually the reactionary bleeding, which is 24-hour bleeding, beta. Then in that case, you have to go for the re-exploration. Within 24 hours, reactionary bleeding, re-exploration, beta. Srinivasa, you say that in the class you understood everything, but then you forget it. Revision, revision, and revision is the key to success, beta. Okay. Perfect. A lot of people answer correctly. Secondary hemorrhage. Then Srijit, thank you very much for your kind words. Rajput, Rahul Singh Rajput, you said that, explain the question again. If you remember, beta, question was that, the patient was operated on Monday. Look at it, Monday. Patient started bleeding on Sunday after 6 days, beta. After 6 days, any bleeding, after 24 hours, any bleeding is reactionary or secondary? It's a secondary bleeding. Secondary is a mild bleeding, little mild bleeding also. Secondary hemorrhage, you go for admission and antibiotics. Monday you got operated, Sunday you are bleeding after so many days. Of course, it's a secondary bleed actually, which is a mild bleed and due to infection. That's why admission and antibiotics, beta. Okay, fine. All good. Ananya, you asked adenorectomy, the commonest complication is hemorrhage, beta. Adenorectomy, Ananya, the adenorectomy, the most common complication will be hemorrhage. When you bleed, when you remove the adenoid, there is a lot of bleeding sometimes, beta. Hemorrhage is the commonest complication. Very good. If any other question is left, in the break time, you can put any other question in your mind. In the break, you put, lunch break, you put that. I'll answer after the lunch break, this all the question again. All the questions are answered till now. Okay, beta. Let us do next concept. Walder ring. Walder ring. Walder ring, write down. It's a ring of lymph tissue in pharynx. It's a ring of lymph tissue in pharynx. I think by now you have seen there are many lymphoid tissue in the pharynx. Adenoid is a lymphoid tissue. Tonsil is a lymphoid tissue. Lingual tonsil is a lymphoid tissue. All these make a defense ring in your system, and that ring of defense of lymphoid tissue is called Wall-Dare ring. So, ring of lymphoid tissue, it has got 6 parts. 6 parts. 6 parts. Number 1, adenoid. Number 2, tubal tonsil around the eustachian tube. Around eustachian tube also there are small lymphoid tissue. Tubal tonsil. Why tubal? Because around eustachian tube. Number 3, palatine tonsil, and I'm sure you know palatine tonsil is equal to tonsil. The real tonsil, the one tonsil you think as tonsil, is called palatine tonsil. Even adenoid is a type of tonsil. Then number 4, lingual tonsil. I remember even tongue has got some lymphoid tissue called lingual tonsil. Number 5, and this is minor this is minor part. Number 5, number 6 is minor part. Some lateral pharyngeal bands, some lymphoid follicle on posterior pharyngeal wall. Lymphoid follicle on posterior pharyngeal wall. Okay, fine. Okay, let us revise this ring, beta. This ring is called Wall-Dare ring, beta. This picture is also there, beta. Wall-Dare ring, beta. 6 parts. Wall-Dare ring is a ring of defense, beta. It's a ring of defense. It's a ring of lymphoid tissue in your pharynx. It has got these parts. Number 1, adenoid. Number 2, beta. Look at around adenoid. Which tube is there? Eustachian tube, and that has got some lymphoid tissue called number 2, tubal tonsil. Then number 3, beta. Number 3, the real tonsil or the palatine tonsil. Number 4, lingual tonsil. These are the main part. Number 5 and number 6 are minor part. Number 5 is lateral pharyngeal bands and lymphoid follicles on posterior pharyngeal wall. Okay, so all these make a ring of lymphoid tissue defense system of your body. It's called Wall-Dare ring. That's given in the image in your notes as well. Okay, bache, fine. Now, let us go further, beta. Now, very important topic, quinsy, beta. Everybody, this is a star topic. Please put a star here. Very commonly asked topic. Quinsy is a very popular topic. Look at the name, Quinsy. Everybody speak about the name of abscess. Quinsy. Bolo beta, muh se bolo. Try to speak when you hear the new word. Quinsy is also called peritonsillar abscess. Now think about it, peritonsillar. Peritonsillar means around the tonsil, outside tonsil. It is not intratonsillar abscess, it's peritonsillar. Peri means outside tonsil. It's collection of pus between tonsil and its bed. It's collection of pus between tonsil and its bed. Anybody, which muscle makes the bed of tonsil? Everybody, this is the bed of tonsil, beta. Here. Which muscle is making the bed of tonsil? Revise it. Superior constrictor muscle. So it's collection of pus between tonsil and its bed. It is more common in adults and it is mostly unilateral. It's only on the one side, beta. Okay. Now let me show you how does the abscess look like, beta. Everybody look at the screen, beta. This is the abscess, beta. Please see, where is the pus? The pus is in this space, beta. This space. This is the pus, beta. Look at it, beta. This is the pus. It's collection of pus between tonsil and its bed, beta. Don't you think so? This pus is going to push everything on the other side, beta. Can you see? There are two findings, beta. If you see your notes, they're written, beta. Two findings, beta. Number one finding is this one, beta. Tonsil is pushed medially. And number two finding is uvula pushed to other side. Tonsil pushed medially, uvula pushed to other side, beta. Tonsil pushed medially, uvula pushed to other side. Tonsil pushed medially, uvula pushed to other side, beta. Okay, tonsil is pushed medially and uvula is pushed to the other side. This is the actually, you can say, the two finding. Now read your notes, beta. Read your notes. Everybody, can you see, beta, over here? Tonsil is pushed medially, uvula is pushed to the other side, beta. Two finding. This is the very important thing, and very important thing is the diagram, beta. This diagram. This is a very vital diagram, and this is a VQ1A visual question also, beta. Nobody should forget this question, beta. If uvula is pushed to other side, if uvula is angulated, think of quinsy, beta. Agar uvula teda hai to mera hai. टेढ़ा है तो भी मेरा है ना, यूवुला टेढ़ा है, अगर यूवुला पुश्ड है, यूवुला एंगुलेटेड है. इफ यूवुला इज पुश्ड, यूवुला इज एंगुलेटेड, थिंक ऑफ क्विंसी बेटा. One important thing is there is no outer neck swelling in quinsy. Please understand, this is very, very important thing. No outer neck swelling in quinsy beta. Quinsy is inside the mouth. Here, nothing is there. No outer neck swelling in quinsy. Okay, fine. Now, what is the chief complaint? Chief complaint is trismus. Trismus beta. Everybody, bolo beta, what is the name of the word? Trismus. What is trismus? Trismus is, look at me, difficulty in mouth opening. It's so much painful. There's spasm over there. You're not able to open the mouth even. Trismus is difficulty in mouth opening. It is due to spasm of, MCI question, it is due to spasm of medial pterygoid muscle. MCQ, it is due to spasm of medial pterygoid muscle beta. It is due to spasm of medial pterygoid muscle beta. Medial pterygoid muscle. It is due to spasm of medial pterygoid muscle. Okay, bache? Medial pterygoid muscle. I hope you remember pterygoids, beta, masticatory muscle. The trismus, look at it. I'm not able to open the mouth because my muscle has got into spasm due to infection. What is the name of muscle? Medial pterygoid muscle. Beta. Oh, hot potato voice. फिर से आ गया. Hot potato voice or plummy voice, also called as muffled voice. Beta. Muffled. MUFFLED. Which voice? Muffled voice, beta. Plummy voice, hot potato voice, beta. Okay, bache. If you are able to recall this word, oh, I've heard this word somewhere earlier in larynx also, but you're not able to recall which topic you actually read it, it means that your brain is perfectly normal brain. But if you are doing active revision, the way I'm now telling you guys, active revision means wearing the sports shoes, beta. Sports shoes, and that's active, active. Just go back. Oh, larynx, hot potato voice came in epiglottitis. Hot potato voice came in supraglottic cancer. Hot potato voice is seen in quinsy also, beta. This is a classical word, hot potato voice. If one thing you have to choose, they give hot potato voice seen in 4 things, and you are confused. Quinsy is the most hallmark thing, beta. If they give you hot potato voice is seen in, if you are having 2-3 overlapping choices, mark quinsy, beta. Quinsy is the classical thing where this word is used, beta. Okay, this is this disease, beta. Okay, beta. Hot voice or plummy voice or muffled voice, beta. Okay, bache. Am I clear? Fine. Okay. Treatment. Per oral IND. What is IND? Incision and drainage, beta. Per oral IND, beta, incident training. Why I'm saying sports shoes culture, beta, sports shoe. I'm wearing sports shoes, beta. I cannot show you, but I'm wearing sports shoes, I prefer that because that keeps me a bit more, active mentally as well. This is probably a habit I developed in my PG days. Like that, in the PG, a lot of work you have to do first year, second year, a lot of work you have to do. When you are wearing, like sports shoes, I think I feel more energetic. Are you noticing one thing? If I don't know whether you notice it or not, I'm standing. It's not easy to stand. Do you think so? But it is not that difficult to also stand. Standing means that you are attentive, you are more energetic, you are more, free-flowing and all that. Everybody has got different ways of remaining active. I'm not saying you stand up while studying. It's not possible for everyone. But you must be knowing that which thing keeps you active. Because why I'm standing? Because I'm damn excited to interact with you. This is what is not, I'm not doing that I have to finish it. I'm absolutely excited to be with you guys. I hope that is visible on my face too. You know what? Because this is what I'm really thoroughly enjoying what I'm doing right now. This is what I'm really putting my energy, heart and soul into it. And I want to be active for that. For that I'm standing. You know what I'm standing? Why? Because I want to give my 100% to you. Same for you guys, beta. When you revise, I want you to give 100% to revision. 100% to revision means full focus on revision, mobile phone off, sitting on the chair with sports shoes means that brain is alert. Let us create deeper impression in the brain, beta. These are tricks and hacks which brain would really not be able to really catch actually. Brain wants to make babies, you know what. For brain, productivity is 0, reproductivity is very much natural. Productivity brain doesn't care much actually. Brain wants to do 100 things to take you away from the books, 100 things to take you away from the study. And you have to confuse the brain by doing some hacks over there. by becoming more alert when brain is really trying to give you a luring advice to sleep tonight. So you just confuse the brain better. Confuse the brain and let us really, and it's not that sleeping is really going to create a lot of activity in your life. Have you ever seen, beta, if you sleep for 10 hours, do you feel more fresh? Do you feel more fresh, beta? Do you feel more fresh when you sleep for 10 hours? Not at all. Not at all, beta. You feel more dull. More dull. More, if you sleep for 10 hours, do you think it's going to add really freshness to your day? Absolutely not, beta. Absolutely not. People might say 8 hours sleep is mandatory for good health. They say that in the Times of India, Google, etc., all the articles and all that. They keep saying that 8 hours sleep is mandatory for good health. Where it is written? Where the hell it is written that 8 hours sleep? 8 hours sleep means 1/3 of your day goes to sleep. It's not like that, but honestly not like that. From my personal experience, I tell you that sleep 5.5 hours is absolutely okay. I have been sleeping for this much for last 21 years now because I changed my habits in the time when I prepared for PG. In 1999, I think I changed my habit of sleeping too much. I was a very lazy kind of guy. And I changed my habit from sleepy to activity. I reduced my sleep quota gradually. But otherwise people will say, if you don't sleep for 8 hours, you will get dull, you get really, very slow, very low, or you will get, hypertension, you get diabetes, you get impotence. I don't know what all they will say. Infertile, all the stupidity they keep telling you. And we get really so scared. But don't worry, but I have been sleeping for 5.5 hours for last 21 years. And I have 2 children also, by the way. So it works. The less sleep also works very well. What keeps you the fresh during the day is, are you doing what you expect to do? Are you honest with your day? Are you doing 100%? Did you fulfill the promises you made to yourself previous day? Did you read that much as you decided? And then today is the fresh day. If you fulfill the promise made to yourself yesterday, you fulfilled all the revisions, you did that with focus, you did that with a lot of attention, then today is a very bright day. But that doesn't matter how many hours you slept. I'm not saying from 8 hours you come to 5 hours. You don't copy me. Don't copy anyone in life. Nobody is that great that you should copy. You are a great creation of the nature. Never look up to anyone, better. Never get impressed with anyone. Look within. You know what is right, what is. You don't need any motivator. The motivation I don't really like on it. What is motivation? Stupidity, you know what? Nothing. Nobody can motivate anyone. You are the real motivator for yourself. You know what is right and what is wrong for you. You are a unique creation, has got a unique kind of needs. Early risers, some people are late sleepers. It's okay, whatever your body is conforming to. But we can, have ideas from other people. 8 hour sleep, bring it to 7.5 hours. Bring it after 2 weeks, 7 hours. Then 6.5 hours after 2 weeks. So that close to the, beginning or you can say May, you are sleeping for maybe 5.5 hours. And rest of the time you devote to your studies. And after 4th June, evening, you sleep for 24 hours a day. I don't have any problem. You are unique creation, respect that. That's not a problem. I'm telling you how to increase the productivity in these days, because right now I'm saying 3 revisions, 3 revision. How can you do 3 revisions in these 3 months when the classes are on and everything? You have to add on number of hours here and there, beta. And how to add the number of hours to really decrease the quantum of sleep actually. But it cannot be done abruptly tomorrow. It has to be decreased gradually, one by one. 30 minutes, decrease it after one week. Believe me, you will feel very good. If I have slept for 5 hours. Last night I slept. It was Shivratri. I was awake till late. So I slept maybe 5 hours maximum. And that's the way I've been doing actually. If I can do, you can also do. Never look up to anyone. Look within. You are your own prime motivator. You know what your design is. You know how can you really channelize your energy. So just try to make sure these 3 months you are super productive. That's why all this, sports shoe culture and all that I'm trying to really introduce you to. Maybe you like the idea. Don't get motivated. But okay, you are grown-up adult actually. Nobody can force you. I cannot force my idea onto you. You might like an idea and might dissect it out, evaluate it. Some of you might like that idea. Some of you might start using that idea actually. So that's what I'm sharing with you. From my failures to how to really proceed to success side actually, to bring certain changes in myself actually. That's what I'm sharing with you. No motivation. I don't like motivation. I don't know what is motivation, Motivation means you hear YouTube, wow, what's the nice thing. And after evening, you're doing the same thing. You know it. When you hear the YouTube, yeah, sahi to bol raha hai, theek bol raha hai, right is. But in the evening, you do the same things. Why? Motivation has to erupt from within. Then it is sustainable. Then it is permanent. Okay? Per oral IND and remove tonsil after 6 weeks. Beta. Corrected, beta, not creaks. W. 6 weeks, but W weeks. 6 weeks. This is called interval tonsillectomy. Because you're doing it after 6 weeks interval, this is called interval tonsillectomy. It's called interval tonsillectomy. Some surgeons remove tonsil at the time of abscess drainage. This is called abscess or hot tonsillectomy. This is called abscess or hot tonsillectomy. Okay? Abscess or hot tonsillectomy. This is old concept. In the bracket go, old concept. We are not doing it nowadays. Not done these days. Old concept. We are not doing it nowadays. It is preferable to wait for 6 weeks and then do the tonsillectomy. And that's called interval tonsillectomy. This abscess tonsillectomy means along with the abscess drainage, at the same time you remove the tonsil also. This is an old concept. We don't do it anymore because there's a lot of bleeding in this type of tonsillectomy. Okay, so Quinsy, the tonsillectomy is done after 6 weeks and that is called interval tonsillectomy. Now you tell me, in Quinsy, is there any neck swelling, outer neck swelling? No. No. Did you notice one thing? In Quinsy, there is no outer neck swelling, beta. Okay, now look at screen, beta. This question, beta. If same history, everybody look at screen, beta. If same history and examination finding as of Quinsy are given in the question, plus outer neck swelling close to angle of mandible, the answer will shift to parapharyngeal abscess. Parapharyngeal abscess. Please understand this question. Quinsy question will never have a neck swelling. But if Quinsy like question is given, along with that he mentions there is outer neck swelling close to angle of mandible, then the answer will be parapharyngeal abscess. Look at me, beta. Parapharynx, beta. What is parapharynx? Lateral to pharynx, beta. Either pharynx, lateral to pharynx, beta. Pharynx, lateral to pharynx. This one, parapharyngeal abscess, beta. So very simple question. If the question is looking like Quinsy, uvula is angulated, trismus is there, plummy voice is there, but must make sure in Quinsy, if you're marking answer at Quinsy, there should be no outer neck swelling, beta. In Quinsy, there is no outer neck swelling, beta. Okay, but if the question is looking like Quinsy, but along with that, there's an outer neck swelling given close to angle of mandible also, then the answer will be parapharyngeal abscess, beta. Parapharyngeal abscess. Now, one more word which is similar to Quinsy is Fmge disease, beta. Fmge. Don't confuse this word with Quinsy. Fmge disease is idiopathic edema of uvula, beta. Idiopathic edema of uvula is called Fmge disease, beta. Can you see uvular edema, beta? Okay. Write down very clearly over here. Don't confuse with Quinsy. Spellings are almost same, beta. This is the importance of this word is, sometimes they might, confuse you. Fmge and Quinsy are different. Fmge is edema of uvula, beta. Uvular edema. Can you see the picture, beta? Only uvula has got edema, beta. Uvular edema, beta. Uvular edema. Am I clear, beta? Fine. Can we go further? So Quinsy is important, very important clue, beta. Uvula teda hai. Uvula angulated, plummy, hot potato voice, trismus is Quinsy, beta. Very simple. If you see the picture, uvula is angulated, Quinsy. But only one thing you make sure. In Quinsy, there should be no outer neck swelling. If in the question of Quinsy, similar question of Quinsy, but along with that he mentions there is a neck swelling close to angle of mandible, then please change the answer to parapharyngeal abscess. Parapharyngeal abscess. Chalo. Now let's go further. Retropharyngeal space. Retropharyngeal space. Retropharyngeal space. Retropharyngeal space. Okay, fine. Now, the space is divided into two halves by a midline band. Everybody draw a diagram here, beta. Small diagram here. Behind the pharynx, this is the retropharyngeal space, beta. Draw a small vertebra here. Retropharyngeal space, draw the side diagram. Retropharyngeal behind the pharynx, beta. Retropharyngeal behind the pharynx, beta. Okay. Now it has got two halves. Divide this in two halves. Okay, fine. Okay. These two halves are called spaces of Gillette. Gillette Mac 3 wala beta. Gillette Presto. Gillette Mac 3. Retropharyngeal space is divided into two halves by midline band. These two halves are called spaces of Gillette, beta. Now, all of you draw, beta. In these spaces, you draw some lymph node, beta. Lymph node. Can you draw some lymph node there, beta? Okay. Now, these spaces have retropharyngeal lymph nodes. Retropharyngeal space have retropharyngeal lymph node, also called as lymph node of Rouvier. Lymph nodes of Rouvier. R for retropharyngeal, R for Rouvier, beta. Retropharyngeal space has got two halves which are called spaces of Gillette. Gillette is Gillette Mac 3 wala spelling. Retropharyngeal space has got retropharyngeal lymph node, also called as lymph node of Rouvier. Lymph node of Rouvier, beta. Okay, beta, lymph node of Rouvier. Okay. Now, infection of this lymph node will lead to acute retropharyngeal abscess. Infection of this lymph node will lead to acute retropharyngeal abscess, beta. Look at screen, everyone. This is your retropharyngeal lymph nodes. By chance, the pus form in this, beta. Can you see, beta? The pus form in one of the lymph node over there, and this will lead to which abscess? Retropharyngeal abscess. Infection of this lymph node will lead to acute retropharyngeal abscess, beta. Okay. Now, clinical picture. 2-year-old child with respiratory distress, comma, drooling of saliva, comma, and inspiratory stridor. Inspiratory, add the word inspiratory stridor. What is stridor? What is stridor? Noisy breathing, beta. Stridor, noisy breathing, beta. You know, upper part will lead to inspiratory stridor, lower part expiratory stridor, middle part biphasic stridor. Pharynx is upper part, na? Supraglottis, upper part, na? Supraglottic problem, inspiratory stridor. Pharynx, inspiratory stridor. Okay. X-ray neck will show widening of prevertebral shadow. X-ray neck will show widening of prevertebral shadow, beta. Okay. Can you see, beta? This is your vertebra. This is your vertebra, beta. This is your vertebra. X-ray neck is there. Okay. This is your pharynx area. Behind the retropharyngeal space is here, beta. Behind the pharynx is retropharyngeal space, and then behind that is vertebra, beta. Look at me, beta. Pharynx, retropharyngeal space. What is there, beta? Vertebra, beta. So this is pharynx area. This is the area of the abscess, beta. Behind the pharynx, there is a big white shadow. This is called widening of prevertebral shadow. Let me put a star over there. This is what I'm telling, beta. This one. This is the widening of prevertebral shadow. Look at the complete X-ray, beta, like this. Please mark it. This is the area I'm saying. Okay, widening of prevertebral shadow. This is the finding, beta. Treatment. Number one, of course, airway management, beta. Airway management. Don't think it's a very respiratory distress. Whenever there is respiratory distress, don't think of antibiotic and other thing. Think of as airway management, beta. Airway management. Number two, incision and drainage. IND, beta. What is IND? Incision and drainage. IND, beta. Incision and drainage. Okay, bache. So retropharyngeal space has got a retropharyngeal lymph nodes. Retropharyngeal lymph node getting infected will lead to retropharyngeal abscess, and that will be typically a child with difficulty in breathing and stridor. It's a X-ray will show widening of the prevertebral shadow like this. In front of vertebra, you will have a big shadow like that, and the treatment is airway management because patient has got respiratory difficulty, and incision and drainage. Okay. Now, let's go to the next topic. Everybody open up the next topic. Ludwig's angina. Ludwig's angina. Ludwig's angina. Everybody open up the topic. Ludwig's angina. It is infection of floor of mouth, also called as submandibular space. Infection of floor of mouth, also called submandibular space. Submandibular space. Floor of mouth is made by mylohyoid muscle. Floor of mouth is made by which muscle? Mylohyoid muscle. Anatomy question. Floor of mouth is made by mylohyoid muscle. Mylo means mandible. Mandible. Can you see mylohyoid muscle? Everybody look at screen. This is your mandible. M mane mandible. Okay, mandible. What is this bone? H. What is H? Hyoid. Can you see there is a muscle here and here. What is the name of this muscle? Mylohyoid muscle. I know mylo means mandible, hyoid. Look at me. One mylohyoid here, one mylohyoid here. This is the floor of mouth. Ye. Floor of mouth is also called submandibular space, this area below the chin. And this floor of mouth is made by which muscle? Mylohyoid. Mylo to hyoid. Mylohyoid muscle. Mylohyoid muscle. Okay, bache? Fine. Now, next line. Source of infection is dental caries. Source of infection is dental caries. Dental caries. Source of infection is dental caries. Look at the screen. Can you see this is mandible? Can you see mandible? I hope you know mandible has got molar, premolar. One of the molar or premolar got some caries, infection, and that comes from here. Oh, the story will always start with dental infection. The story will be dental infection, okay? Dental infection. Dental infection. Okay, now, next bacteria. Which is the bacteria causing it, Now, guys, wherever the bacteria comes, don't write only Staph aureus, Staph aureus, Staph aureus. No. Every bacteria is not Staph aureus, hai? Oral bacteria, oral, not skin, oral bacteria, Streptococcus. Bacteria, microbiology question. Bacteria is Streptococci plus anaerobes. Streptococci plus anaerobes means mixed bacteria. MCQ and microbiology question. It's a mixed bacteriology, aerobe and anaerobes. Okay, bache? Fine. Mixed bacteria. Chief complaint: chin swelling and trismus. What is trismus, Chin swelling and trismus, What is trismus? What is trismus? Difficulty in opening mouth. Trismus is difficulty in opening mouth. Chin swelling and trismus, Chin swelling and trismus, Okay, fine. Now, treatment is external IND, incident drainage. Let's see the main point of this topic, Ludwig's angina. Everybody speaks about every angina is not cardiac angina, Don't think every angina cardiac angina. Ludwig angina means something related to ENT, After dental infection, patient develop chin swelling and trismus. This is infection of floor of mouth, floor of mouth. The story will start from dental infection. After dental infection, the patient develop chin swelling and trismus. It's Ludwig angina. Which bacteria is causing it? Streptococci plus anaerobes, That's all. Okay, fine. Now these are some things you need to just cram up, No need to discuss. It's just some miscellaneous thing I wrote over here. You just for your this thing, whenever you are revising this, at the end of the ENT, you just read all these things. It's okay. But I want to discuss something else, beta. Come over here, beta. Come over Fordyce pod, beta. Everybody, Dharma question. Fordyce pod is ectopic sebaceous gland in mucosa. Fordyce pod is ectopic sebaceous gland in mucosa, beta. Everybody, can you tell me sebaceous gland? Look at me, sebum. Can you see my sebum, beta? Sebum. Sebaceous gland are part of skin, not of mucosa, not inside the mouth, beta. If by chance sebaceous gland form in the mucosa, they are called Fordyce pod, beta. Fordyce pod means ectopic sebaceous gland in mucosa, because I know sebaceous gland are part of skin, not of mucosa, beta. Okay, ectopic sebaceous gland in mucosa is called Fordyce pod, beta. Okay, reverse smoking is sutta. Sutta, beta, sutta. Reverse smoking is sutta, beta. Reverse smoking means the burning side of cigarette is inside the mouth. Oh, people are crazy, people are crazy. The burning side of cigarette inside the mouth, it's a risk factor for hard palate cancer, beta. Why? The fuming heat will irritate your hard palate, because the burning side of cigarette is inside the mouth, and that can be a risk factor for hard palate cancer, beta. Okay? Now, most common site of oral cavity cancer is lateral border of tongue. If the question says that, what is the most common site of oral cavity cancer? Oral cavity, in general, in the whole world statistics, lateral border of tongue. But most common site of oral cavity cancer in India, India is different, beta. We are having a habit of chewing everything on the planet, beta. We want to chew whole planet, I guess. Tobaccos, katha, chuna, supari, betel nut, pan. We want to chew the whole planet, I guess. You know what? India is different that way. You know what? So, in India, the oral cavity cancer are different from the whole world. So, what is the difference? In the world statistics, the most common site is lateral border of tongue because of smoking and all that. But here, what we do is, look at me, beta. Have you seen people doing pan masala, rajni ganda? Name is ganda, beta. Rajni ganda. Naam hi ganda hai. Naam hi ganda hai. Rajni ganda. How can it be safe for you? Even supari is a very dangerous thing, beta. Now you put that in tobacco and all that, then you do for 5 minutes, they keep doing like this, and then they do that, and then they transfer everything in this gutter. What is this gutter? This gutter is gingio buccal sulcus. What is this gutter, beta? This fossa is gingio mane gum, buccal mane cheek. This sulcus is gingio buccal sulcus, and there you put that whole masala over there. And this masala is the site of the cancer, beta. So most common site of oral cavity cancer in India is different from the world. In the world, it is lateral border of tongue, and in India, particularly if questions till the time question says in India, don't think India, beta. When the question says in general thing, except PSM. PSM is India specific, beta. But otherwise, if the question is silent about which part of world, it is world statistic, beta. So most common site of oral cavity cancer in general is lateral border of tongue, but in India, it is gingivo buccal sulcus of buccal mucosa. Gingivo buccal sulcus of buccal mucosa, beta. Yaad rakhe, beta. They are two different. India is different. We are chewing tobacco. Pan masala, pan parag, rajnigandha, vimal, shikhar, and all that. How many people have died out of this vimal, shikhar business, beta? People think they're eating kesar, beta. They're eating kesar. This, that, what is the name of the actor, What is the name of that actor? Stupid actor. I'm not able to recall his name, actually. That big hoarding. Whenever I go to any city, Ajay Devgan. That Ajay Devgan is making people believe that when they eat this vimal, shikhar, and all that, they're eating kesar, beta, kesar. You know what? Have you seen that comedy? You know what? Some lady was pregnant and she says, "I want very fair child, very fair child." You know what? Somebody told her that you should eat kesar in the milk. I will put some kesar in the milk. Morning, evening, you take kesar in the milk, actually. And she saw Ajay Devgan, kesariya. You know what? And she brought this vimal shikhar, and every day she used to put one pouch in the milk and stir that and drink that. That's a comedy, you know what? But people get influenced by these people, you know what? That's why they are really causing so much harm to society by propagating something which is dangerous. But if Ajay Devgan gets cancer today, he will get the best hospital of the world, Sloan Catering, MD Anderson Clinic, to get the surgery done. This Sharad Pawar got the surgery done. But, if a rickshaw puller who is impressed by looking at Ajay Devgan's hoarding in the street and he starts eating this Vimal Shikhar and all that, if he gets the cancer, where he goes? AIMS Delhi or CMC Vellore or Jipmer Pondicherry or Tata Memorial Mumbai. The waiting list is what? 1 month. Minimum waiting is 1 month for the cancer surgery. In 1 month, a T2 will become T4. And the story changes a bit over there. So this India has got different, there's a lot of, this thing is, oral cavity cancer is very, 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 very important thing, very common thing in India, beta. So one question, most common, add one question, beta. Most common head and neck cancer in India is oral cavity cancer. Most common head and neck cancer in India is oral cavity cancer, beta. Most common oral cavity cancer in India is most common head and neck cancer in India is oral cavity cancer, beta. Oral cavity cancer. Oral cavity cancer, beta. Okay, fine. Somebody asking fire pan, can it become a risk factor for you? Fire pan, if you are daily eating every day, 2 to 3 times, it can become risky. 1 or 2 times you can try it. We all try. We are not saints here. We are not a saint over here. We are here to try a couple of things. Fire pan, like CP has got one shop with fire pan. 1 or 2 times in a year you can try that. But if you are eating fire pan morning, evening, night, TDS for next 2 years, then you are troubling yourself for sure. Okay. Commando operation, beta. Commando operation is oral cavity cancer. This surgery is done for. Write down. It's a surgery. This surgery is done for. This surgery is done for oral cavity cancer. This surgery is done for oral cavity cancer. Beta. This surgery is done for oral cavity cancer. What is the name of surgery? Commando operation. Full form is combined oromandibular resection with the reconstruction. Combined oromandibular resection with the reconstruction. Combined oromandibular resection with reconstruction. Combined oromandibular resection with the reconstruction. Beta. With reconstruction. Okay, bache? Fine. Is it clear to all? So just couple of statistics over there. Okay. Once again, beta, most common oral cavity cancer in India is gingivo-buccal sulcus of buccal mucosa. But most common oral cavity cancer in general is lateral border of tongue, beta. Okay. Now, next one is that the Forde spot is ectopic sebaceous gland in the mucosa. Okay, because sebaceous gland are part of the skin, not of mucosa, beta. Okay, now next one is commando operation is done for oral cavity cancer, beta. Commando operation is done for oral cavity cancer. It is combined oromandibular resection with reconstruction, beta. Combined oromandibular resection with reconstruction, and this surgery is done for oral cavity cancer. Beta. Okay, bache? Fine. Chalo. Everybody, let us open up the third part now of ENT. Go to the page number first segment of the PDF, and the topic name is nose and paranasal sinuses. Beta. Nose and paranasal sinuses. Beta. Everybody open up. Nose and paranasal sinuses. Everybody open up the first page of your this workbook, and let us start the third topic of ENT, and the third topic is nose and paranasal sinuses. Okay, after every major segment, there is one page left over there as a blank page. You can write any additional point over there, beta. Okay, let us start now. Nose and paranasal sinuses. Everybody open up this one. PNS, nose and paranasal sinuses. This is my email ID again, drajidhanent@gmail.com. However, the best thing is to write it on Telegram so that everybody can know better. Telegram is the best way. If you have got any question, any query, after you use a chat box. If chat box is not being used by you and you're revising and you want to put a question, Telegram is a wonderful thing to really use. I could put an audio there, you can hear it, other people can also hear it better, okay? But still, if you've got a personal question which you don't want to discuss with anyone, if you have anything like that, then you can mail me on this email ID, okay? I wish you were here, we would have really chatted in person, but it's okay. Now, the next topic, nose and paranasal sinuses. Let us start this one, beta. Are you ready? Are you ready with the nose and sinuses topic now? We've done larynx, done pharynx, and now the first topic out of nose and sinuses is external nose, beta. Are you ready for it? Write in the chat box. Are you ready to learn the third topic? Are you excited to learn the third topic? Write in the chat box, beta. Forget about attending classes, finishing a subject. My question to all of you is, are you excited to learn the third topic of ENT? Because are we just, working at a spinal level, or are we able to create interest in your mind to learn the subject, to know the clinical things, to know the anatomical things, to become better doctor of the future also? My concern is not just Fmge. That's one step. After that, I want you to become able practitioners, good doctors of your society, wherever you belong to. Okay? Are you excited to learn the third topic? Thank you, Rajput. Very good. Very nice. Okay, so let's start the first topic, beta. The first topic is external nose, beta. Now, external nose is made of 4 paired structures. Everybody, external nose is made of 4 paired structures. But first understand, then we'll see the notes, beta. External nose is made of 4 paired structures. Thank you, Tejaswani. Thank you, Rahul. Thank you to Rahul. Okay. Now, what are the 4 paired structures? 4 paired structures, beta. 4 paired structures. Nasal bone. This is nasal bone, beta. This area is nasal bone, beta. Look at this, beta. Guys, this is what you have to really understand. This is external nose, beta. Everybody, this is your external nose. Everybody is so particular about this nose, beta. Everyone. We keep looking in the mirror. Oh, it's a straight nose, or a deviated nose, or a mota nose, or a patla nose, or a sharp nose. This is very much, we are concerned about this outer look of our body. You know what? This is very much, everybody look in the mirror like that, na, hai na? Teda hai, whatever, seedha hai, acha hai, tikha hai, mota hai. But don't worry, just 5 millimeter deep to the skin, everyone is same. Everyone is same, beta. Just 5 millimeter deep to the skin, everyone is like this only. Don't worry, outer thing is anything. What counts is what you are inside, not outside. Outside, everybody wants to look perfect. I am the most perfect person on the planet. I want to prove it to the other people. I don't know why we want to prove it. Nobody gets convinced by your this thing, beta. No one is perfect, What matters is what you are doing, because you know what you are. You know what you are. Why to prove to other people, Why you want to prove it to other people? It's okay, whatever. You are concerned about your relatives, what? Oh, what will they feel if I do not pass? They won't feel anything. Most of them will be happy. Most of them will be happy, unfortunately. I'm sorry to say that, but that's a fact. Why to bother about those people who are happy with their failure? I have a question to all of you. We're too concerned about other people. We're too concerned about what people feel about us. We're too concerned about what they will feel with our failure. They will not feel anything. At the most, they will feel happiness. Most of them. Except for few people, few friends. Mother, father, siblings. They are the ones who stand with us. Let us be bothered about them, not about 99.9%. So your fear is that what if fail, what do they feel? Nothing. Don't worry. You're doing it for yourself, your own life. The moment you clear the exam, you become financially independent. I'm not saying you become rich, but at least you start earning 60, 70,000, and in Delhi you start earning 90,000 rupees as a JR after internship. Not a bad money. Within 3 months, you earn 2,70,000. Not a bad money. It's good money. When the first salary came in my account, when I was doing PG, of 3 months salary, I suddenly felt, I am Tata, I am Birla. I am Ambani, I am Adani. That typical feeling of Aham Brahmasmi, Aham Brahmasmi. This exam will give you financial independence. You're not dependent on anyone. Not anyone, beta. Doctors never die of hunger. Doctors never die of hunger, beta. Have you ever seen a doctor dying on the road or died on the road with kwashiorkor or marasmus like that, with the bones like out? Have you seen ever a doctor, a picture in a newspaper who died of hunger? Hunger. The, the major worry of the human is hunger. I should not die of hunger. Okay? But doctors never die of hunger, beta. We have got sufficient things. This exam will make sure that you get sufficient money to survive yourself. For females, it's very important. No female should be dependent on a male, actually. No female should be dependent on a male for anything. Anything means anything. Nobody should marry someone and be in the marriage because somebody else is earning for you. A female should be independent. Independent. I can survive on my own too. I'm living with you by choice. Two people should live together by choice in a marriage. Not that one person is dependent on the other person. My wife earns 3 times more than I do. She can kick me out of a house anytime, actually. That's a dream I have for you also. May God bless you. This is a dream I have for you also. May you become financially independent. Not rich. May God give you richness also if you want it. But at least becoming financially independent means that I'm not dependent on anyone. I can maintain my own things on my own. Basic things, food, AC, rental, maybe a small car, etc. I can manage on my own actually. This exam is going to give you that financial independence after your internship is over. So let's work for ourselves, not for others. Let's not look outside what people will feel. Let's look at us, that it's one life to live, one life to love. I want to do it fully. Yes, I failed last time, okay. This time I want to really try my level best to make it happen. This is my first time I'm appearing in the exam. I want to finish in the first go itself. I want to start my life at the earliest possible. So, not outward thinking, but inward thinking. Inward, everybody is same. And you know what you are inside, actually. So, external framework is made of 4 paired structure, beta. Number 1 is nasal bone, beta. Can you see, beta, this point number 17? This is your nasal bone, 17 number, nasal bone. After that is some cartilage over here, beta. What are the cartilages? Please see over here. This is nasal bone area. This upper lateral cartilages. Then we have got lower lateral cartilages. Okay. Then we have got small cartilages, which are called lesser alar or sesamoid cartilages. Lower lateral, also called as alar cartilages, they look like this U. They form the external opening of the nose. The lower this is the lower lateral cartilages. Look at me, beta. Look at me. This is a lower lateral cartilage. This is one cartilage here. So nasal bone, upper lateral cartilage, lower lateral cartilage, beta. Okay. Now let's come back to the PDF, your workbook, beta. External nose is made of 4 paired structures. Number 1, nasal bones. Number 2, upper lateral cartilages. Number 3, lower lateral cartilages, also called as alar cartilages. ALAR. They form external opening of nose, beta. Add the word of nose. They form external opening of nose, beta. They form external opening of nose, beta. They form external opening of nose, beta. Okay. Number 4, lesser alar or sesamoid cartilages. These are small cartilages between upper lateral and lower lateral cartilages. These are small cartilages between upper lateral and lower lateral cartilages, beta. Okay, fine. Let's revise once again, beta. Now this picture describes everything, beta. Everybody, this picture describes everything. External nose is made of 4 paired structure. Number 1, bolo beta, bolo speaker beta. Number 1, nasal bones. Number 2, upper lateral cartilages, the major chunk. Number 3, this lower lateral or alar cartilages or alar cartilages, they form external opening of nose. And number 4 is lesser alar or sesamoid cartilages. These are small cartilage between upper lateral and lower lateral cartilages. That's external nasal framework. Okay? Now let's go further, beta. Next is nasal valve. All of you touch this area with me, beta. All of you touch this area. Everybody look at screen, beta. Look at screen. And everybody, I'm putting an arrow and you touch that area, beta. This area. All who touch this area, This area, you can feel the junction of upper lateral and lower lateral cartilages. This area is labeled as nasal valve area. Nasal valve, it's the junction of upper lateral and lower lateral cartilages. It's junction of upper lateral and lower lateral cartilages. Now, sometimes what happens is the nasal valve can be collapsed. Can you see? What is nasal valve? Junction of upper lateral and lower lateral cartilages. This is, can you see the nasal valve is collapsed? Look at screen, everyone. Can you see nasal valve collapse? Oh, this is normal side. This is the collapse side. Now, how to check the problems of nasal valve or how to check the obstruction at the level of nasal valve is a test called Cotter's test. Cotter's test is done to check the blockage of nasal valve. Cotter's test is done to check the blockage of nasal valve. Look at screen, first of all understand Cotter's test, C-O-T-T-L-E. Look at me. How we do it? Look at me, look at me. We keep the two finger on the cheek and pull it outward. If this makes the breathing better in this patient of nasal valve collapse, mean nasal valve is obstructed. Okay, so Cotter's test, C-O-T-T-L-E, C-O-T-T-L-E, Cotter's test is done to check, write down. This is Cotter's test, beta. This is Cotter's test. Is done to check blockage of nasal valve. Cotter's test is done to check the blockage of nasal valve. This is the MCI question. I mark it MCI question. Cotter's test is MCI question. Okay, beta, MCI question. This is a VQ mane visual question also. Beta. Okay, bache. Cotter's test is done to check the blockage of nasal valve. What is nasal valve? Again, repeat with me. Nasal valve is junction of upper lateral and lower lateral cartilage. This is the nasal valve area. Sometimes this valve can be collapsed. Which test we do to check the blockage of nasal valve is called the Cotter's test. And how we do it? We keep the two finger on the cheek and lift it outward. Beta. If this makes the breathing better, then nasal valve collapse is the problem. Beta. Okay? So Cotter's test is a visual question, is a one-liner question also. Beta. Let us go further. Beta. Now saddle nose. Saddle nose. Beta. Saddle nose is depressed nose. Beta. Can you see saddle nose? Beta? Idhar dekho. Can you see there is a depression here, beta? What is saddle, beta? In English, saddle is horse's saddle. You know, घोड़े की काठी, horse's saddle, beta. You know, horse's saddle. You know, horse has got a saddle means जिसमें घोड़े पे बैठते हैं ना, saddle. Saddle means depression. Saddle nose is depressed nose, beta. What are the causes of the saddle nose? Very common problem in our practice. What we see? Number one, trauma, leprosy, tertiary syphilis. Put in a question, beta. This is the MCQ, beta. Tertiary syphilis and septal surgery, beta. When you're operating the nose, you may destroy the septum too much and there will be depression of the nose, beta. Okay, bache, fine. Treatment is augmentation rhinoplasty, surgery, beta. SX means surgery. Augmentation rhinoplasty by using iliac crest graft. Augmentation rhinoplasty by using iliac crest graft. Iliac crest graft. You know iliac crest? Where is iliac crest? On the hip bone. Look at me. This is iliac crest. Here. You take a graft from here and you make a small bony graft and put in this area to fill the defect. Augmentation means to fill the defect. Augmentation. Augment means to fill the gadda, to fill the defect. Augmentation rhinoplasty by using iliac crest graft. Okay, fine. Now, next, rhinophyma. Rhinophyma. Very important. VQ, beta, dermatology visual question, beta. VQ means visual question of derma. First of all, see this, beta. Can you see, beta, over here, the rhinophyma, beta? This picture, don't forget. Nose having, you know, irregular kind of swelling here and there. The rhinophyma. Okay? Rhinophyma also called as potato nose, beta. Potato nose. Potato nose, beta. Okay? It is hypertrophy of sebaceous glands of skin of external nose. That's MCQ, beta. It is not a tumor, it's only hypertrophy, beta. Please don't forget rhinophyma, beta. Rhinophyma, potato nose, it is hypertrophy of sebaceous glands of skin of external nose, beta. It's not a tumor, Okay, only a cosmetic problem. It's more common in males. It's more common in male. If you remember, Om Puri, a Bollywood actor. Om Puri, a Bollywood actor, had the same kind of nose. But if you remember, Om Puri had smallpox also, by the way. Om Puri had got this kind of nose also. More common male. Males, Om Puri, male. Hai na? It's more common males. Beta. Okay, it's not a tumor. It's only a cosmetic problem. Beta. Okay, fine. Rhinophyma, also called as potato nose. Beta. Okay, will you remember it, beta? Don't forget this picture, beta. Please make a mark in your brain. Some nose with this kind of appearance. It's not a tumor. It's only hypertrophy of sebaceous glands of the skin of external nose, and it's called rhinophyma. Phyma, rhinophyma or potato nose, beta. Potato nose. Now, one more question of VQ, beta. Derma question, beta. Visual question. Most common malignancy of skin of external nose is basal cell carcinoma, also called as rodent ulcer. BCC, basal cell carcinoma or rodent ulcer. How present, beta? Write down non-healing ulcer with rolled out edges. Non-healing ulcer with rolled out edges, beta. Non-healing ulcer with rolled out edges. Non-healing ulcer with rolled out edges, beta. Can you see, beta? Can you see there is ulcer here at the nose and the edges are rolled out. Rolled out edges. Non-healing ulcer with rolled out edges, beta. Okay, bache, fine. Am I clear, beta? Non-healing ulcer with rolled out edges, beta. Write down. The same lesion can be seen on pinna of ear also, beta. Pinna of ear. Beta. So basal cell carcinoma or rodent ulcer, they can give you at two places, beta. One is nose, other is pinna of the ear, beta. So this kind of ulcerative lesion which is non-healing with rolled out edges, any non-healing ulcer shown on the nose or pinna, please mark it basal cell carcinoma or rodent ulcer, beta. Don't dissect the question too much. Don't over and think and change the question answer to a rare answer and mark the answer wrong, beta. Don't do that. Any non-healing ulcer shown on the pinna or on the nose, please think about basal cell carcinoma or rodent ulcer, beta. Okay, बच्चे, fine. चलो आगे चले बेटा. Visual question, बेटा. Now one next is rhinolith. Rhinolith, beta. Rhinolith is formation of stone in nasal cavity. Formation of stone in nasal cavity. Formation of stone in lith. What is lith? Lith one is stone, beta. Formation of stone in nasal cavity. Now, okay, am I seeing this in the OPD? It's a very common thing, beta. Some stony kind of mass form in your nose. From where this, all the material comes? Air. Air has got multiple impurities of different salts. They come and deposit in your nose through air, and they start getting bigger and bigger and bigger in size, and this is what the picture is. Now you think like a doctor, beta. You're future doctors, beta. Think like a doctor. If you've got a stone in the nose, what symptom it will generate? Number one, pain. Stones are a pain, headache. The pain will go to the head also, headache. Nasal blockage. Bad smell from the nose, beta. Foul smell from nose. Why? It's a foreign body kind of thing, na? Bad smell from the nose. And epistaxis, bleeding also. Can you see? It will touch the mucosa and that will be starting bleeding, beta. Epistaxis. Read the symptom, beta. Nasal pain, headache, blockage, foul smell, epistaxis. Treatment is endoscopic removal. Endoscopy removal. Very simple question, beta. It's not never. This question has never come in the exam, but you should know a couple of things just like that also. It's not everything is exam. Rhinolith, stone in the nose, is a possibility clinically, beta. You should know. Now, the next one, very common thing, very common is, I think this one you would have maybe seen or you will see. Can you see foreign body in the nose, beta? Can you see this pea color? Can you see some color thing has foreign body in the nose, beta? Foreign body nose, it is more common in school-age children. Foreign body nose is more common in school-age children, beta. Foreign body nose is more common in school-age children, beta. Foreign body nose is more common in school-age children. Guys, do you remember school age, beta? School age, the most wonderful age, school age. School, you use a pencil box, beta, pencil box. And that pencil box had got a lot of things, erasers and pencils and scale and whatnot. है And if you remember, in those days, we used to have pencils with inbuilt eraser at the end, beta. Pencil ke piche eraser laga hota tha, inbuilt eraser. In those days, even that pencil with eraser was a big thing for us. But today, even the iPhone is a basic thing for us. Even iPhone is not a big thing here. It's iPhone, not a V phone. iPhone Pro, iPhone 12, iPhone 13, I don't know where we are going actually. Nothing gives us a kick now. That's a very sad thing, unfortunately. But in those days, I remember even a pencil with eraser at the back used to be a big thing. I don't know which school you studied. I studied from a government school. So government school are real different schools, you know what. In government school, I remember, teachers are roaming around here and there, and some kids are busy in their own world. And you know what they're doing? They're rotating that eraser in the nose. They're having very good time. They're rotating the eraser in the nose, and the teacher would take a round in the class. He will look at the student who is rotating the eraser in the nose and is having good time, and teacher doesn't want students who have a good time. He slaps him in the face from the side. What are you doing? And this poor chap removed the pencil and he says, oh, eraser is still inside the nose. Eraser is still inside the nose, beta. And now he's scared. He doesn't want to tell his dad or mom that, eraser is in the nose. He wants to keep quiet because, he will tell his dad that, eraser is in the nose, another slap from the father also. He doesn't want that. He keeps his mouth shut. 3-4 days passes. The foreign body in the nose, eraser get infected. So, from the infected foreign body, the pus comes, the smell comes, the blood comes, and the same question comes in MCI. MCI, beta. Read the question, beta. 7-year-old child presenting with 7-year-old child presenting with unilateral, foul-smelling neural discharge. The key word is highlighted about unilateral is the key word. 7-year-old child, the key word is unilateral, foul-smelling neural discharge and epistaxis. Single-side smell, single-side discharge, single-side bleeding. Beta. Why single-side? Because it is due to foreign body in the nose. Beta. Due to foreign body in the nose. Beta. Treatment is endoscopic removal. Treatment is endoscopic removal. Beta. Endoscopic removal. Treatment is endoscopic removal. Beta. Put an endoscope, pull it out. Lot of foreign body we remove, beta. Lot of foreign body we remove. Foreign body like, this is very common. Eraser are very common. Wax color are very common. Wax color, they put in the nose. This is very common. This, for example, pea seed, mutter, rajma, tamarind seed. The children keep putting something else in the nose. I don't know what they want to do. But some children have got a habit of putting one or other thing in the nose, beta. Sometimes rajma, sometimes tamarind seed, sometimes pea seed or whatnot. I don't know what they want to grow in their nose, but they keep trying it. Probably they want to trouble their parents, I guess. You know what? That's what they are feeling. I remember one child, in my clinical practice, Lady Harding Medical College, I was removing foreign body from the nose. There's so many paper, beta. Papers here, whole nose is full of paper. So many paper, it took me time to remove all the papers. So many paper, not one paper. Many paper folded here and put in there. Every paper. We removed it, we washed it, and then after in the evening, I met that child in the ward before discharge. I said, what's your name? He said, Atul. My name is Atul. I said, Atul, come here. I said, what was that paper? Tell me, what was that paper? He looked around that his father is not there. And then he told me, coming close to me and said, Doctor, uncle, it was my mark sheet. It was my mark sheet actually. He didn't score well. He wanted to remove, teacher must have given the mark sheet to get signed by his father or mother. He tried to just, evaporate the evidence totally. He just tore the mark sheet apart and he put everything folded, didn't throw in a dustbin, I don't know why, but he put everything in the nose. Sometimes they have the habit like that. Endoscopic removal. Okay, we have to do endoscopic removal. This is a star question of MCI, beta. If you ever get a younger child, 7-year-old child with single side smell, single side blood, single side discharge, it's 100% foreign body in the nose. Now on PG level question. If there's a disc battery, read the question, beta. If there's a disc battery in nose, ear or esophagus, Disk battery in nose, ear or esophagus, beta. Have you seen the disk batteries, beta? Disk batteries? Calculator batteries, watch battery, small disk batteries. Now, these are active batteries, beta. These are active batteries. These are alkaline batteries. They're coming in contact with the mucosa or skin or anything. They will start leaking the alkali, beta. And the alkali can damage the human tissues. And the alkali will cause necrosis. Can you imagine a child swallowed this disk battery? It's active battery, he swallowed it. It goes to esophagus. If you don't remove it urgently, then this may lead to leak of alkali in the esophagus, and that can lead to esophageal perforation. Esophageal perforation. Esophageal perforation. That may lead to esophageal perforation, beta. Esophageal perforation. That may lead to esophageal perforation, beta. Am I clear, beta? Esophageal perforation. Esophageal perforation, beta. Okay, bache? Fine. Okay, done. Chalo. Go to your notes, beta. And read PG question. If the disk battery nose, ear or esophagus, treatment is urgent removal. Write down urgent removal, beta. Not removal. Urgent removal, because these are dangerous batteries, beta. They are active batteries. They may release alkali, and alkali cause necrosis, beta. And you read esophagus can lead to perforation, beta. Write down perforation. They can cause perforation of esophagus, beta. They can cause perforation of esophagus also, beta. Am I clear, beta? Urgent removal, perforation can happen. Okay, let's go further. Myiasis. Myiasis, beta. What is myiasis? Presence of maggots in nose, beta. Maggot. Presence of maggots in the nose, beta. Maggot. Maggot in the nose, beta. These are maggots, beta. Can you see, beta, maggots, beta? These are maggot, beta. Maggot, beta. देख के अच्छा लगा? Are enjoying it? Can. These kind of कीड़े मकोड़े in the nose, beta. Maggot. What is a maggot? Maggot. Right. Just read that. Maggots are, what are maggots? Maggots are larvae of housefly, beta. Maggots are larvae of housefly, beta. This is a maggot, beta. This is maggot. Maggots are larvae of housefly. Okay. Now maggots are larvae of housefly, beta. Housefly, housefly? The flies are in every house, and the foul smelling condition lead to myiasis, beta. You have a foreign body or anything which emits bad smell, and the flies are attracted by the bad smell. They enter the nose. Inside the nose, they lay eggs. Inside the nose, they lay the eggs. From the eggs, the larvae come out, and those larvae are called maggots. Maggots are larvae of housefly, and the scientific name of housefly is Chrysomia, beta. Chrysomia. Chrysomia is the name of the family, beta. I hope you remember the 11th class torture, zoology. Zoology, beta. Remember housefly. The commonest housefly is Musca domestica. Musca domestica, beta. If you remember, I remember it still. I think I studied a lot in my MBBS preparatory days, and then in my PG preparatory days. 2 times I studied a lot in my life, actually. And I still remember those all bryophyte, pteridophytes, gymnosperms, angiosperms. I think I still remember them, because at that time I had to study. I told you that I had no option of going out of the country to study. My dad said only one thing, one chance to study. One chance only, Otherwise, you have to sit on the shop, That's that. I was really not keen to do that, the shop thing and all that. So I really had to study a lot. So this is still within me, Musca domestica, Mangifera indica, like that. So, but if you remember, we used to do taxonomy. If you remember taxonomy, the species, the genus, the phylum, the family, the order, and the kingdom. So family, the family of the housefly is Chrysomia, beta. Foul smelling condition will lead to myiasis, beta. Now treatment. What if you have got some insect like this in your nose, beta? If this is there in your nose, would you adopt them? No, you have to kill them. Of course, kill them, na. Howsoever kind you may be, you can't adopt them in your body. You have to kill them. But killing doesn't mean that you put the black head spray in the nose. You know black head spray? Head spray. Don't put the black head spray in the nose, boss. 10 spray, 10 spray. No, that's toxic for the humans also. For killing them, you have a special oil called maggot oil. Now, maggot oil contains what? Maggot oil contains chloroform. Right? Now, maggot oil contains plus turpentine oil, beta. MCQ da. Chloroform is the main thing, beta. Oil can be any. Maggot oil contains chloroform plus turpentine oil, but main thing is not turpentine oil. Main thing is highlight the word chloroform. Chloroform is the main ingredient which kills the larvae, beta. Chloroform, beta. And use mosquito net also, of course, because you have to keep the flies away from the patient. Chloroform. Chloroform is the main energy. Oil can be any, beta. Okay, chloroform is the main thing. Actually, you cannot put the pure chloroform in the nose, beta. Why can't you use the pure chloroform in the nose, beta? I hope you know chloroform is anesthetic agent. Anesthetic agent. If you put pure chloroform in the nose to kill the larvae, in the overdose, it may kill the patient also. In the overdose of the chloroform, it may kill the patient also, beta. Then attendant will ask you, sir, maggot, मर गए. Patient, वो भी मर गया. तो क्या बोलोगे? यहाँ भाई थोड़े side effect तो हैं इसके. नहीं ना? You can't do that, na? So better dissolve the chloroform in the turpentine oil. When you dissolve the chloroform in turpentine oil, it cannot evaporate. Then it is not an anesthetic agent. Okay? Fine. Next one. Nasal bone fracture. Next topic, but everybody get back to the next topic. Nasal bone fracture. Nasal bone fracture. It is the most commonly fractured bone of face. Yes. Nasal bone is a very delicate bone, but I showed you, very delicate bone. It's the most commonly fractured bone of the face, beta. Okay. Now please look at the screen, beta. Let me show you. Sometimes this bone, beta. Can you see point number 17, beta? It's a very thin bone, beta. Something got hit on the nose and the bone got fractured. And when you see the patient, it looks like this, beta. Okay. Can you see the deformed nose, beta? Deformed nose. And when you move the, fractured bone, there is a click, click, click kind of sensation that is called crepitus. Crepitus, beta. Okay. You know, orthopedic radius got fractured. If you do click, 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 if the bone is fractured, if you move the fractured part, tick, click, 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 and sound is called crepitus, beta. Write down. Write down. On the side, write down. Clinical picture. Nasal deformity. Nasal deformity, crepitus, plus minus swelling, in the bracket, in late cases. If patient come next day, then swelling also. So patient has nasal deformity, crepitus, plus minus swelling in the late cases, beta. Okay. Now, treatment. Write down treatment A and B, beta. A and B. A is immediate close reduction before edema starts using Walsham forceps. WALSHAM. Walsham forceps, beta. Using Walsham forceps, beta. WALSHAM, Walsham forceps. But B, if edema is already there, then wait for 7 days and then reduce fracture. So 2 questions, beta. If edema is not there, if swelling is not there, then you have to do immediate close reduction before edema starts using Walsham forceps. But B, if edema is already mentioned in the question, then wait for 7 days and then reduce the fracture, beta. Okay? Why wait for 7 days? Wait for 7 days for edema to subside. Why wait for 7 days? For edema to subside, beta. Why wait for 7 days? For edema to subside, beta. To subside. For edema to subside, beta. Let's see the patient, beta. Let's see the patient, everybody. This is your patient, beta, who got the nasal fracture, who got the nasal deformity. There is a crepitus also. There may be swelling, there may not be swelling. Swelling come in the late stages. And this patient, if you do the X-ray, beta, can you see? Write down one word over there in the sidebar. Write down side word. Write down on the here. Write down investigation, beta. Investigation will be X-ray nasal bones, beta. X-ray nasal bones, beta. X-ray nasal bones, beta. Okay. Now, how the X-ray look like, beta? Look at screen, beta. How the X-ray look like? Please see over here, beta. Now, please see over here, X-ray. Can you see? This is your nasal bone fracture, beta, over here. This is your nasal bone fracture over here. Am I clear? Fine. X-ray. This is the, can you see the bone is fractured at the white arrow, beta? Okay. Now, the treatment is of two types, beta. If the question has got no mention of swelling, then you do immediate close reduction before edema start, using which forceps, beta? Using which forceps? Walsham forceps. Using which forceps? Walsham forceps, beta. Walsham. Can you see Walsham forceps? But if the question says that if edema or swelling is already present, then wait for how many days? 7 days for edema to subside and then do the fracture reduction. Okay, beta. Now, how we do it? Let me show you, beta. Let me show you. If you see this one, this is your fracture reduction, beta. Please see, this is your trauma point. Can you see the black trauma point, beta? This is your trauma point. Patient is under anesthesia. This is close reduction, beta. What is the name of the forceps? Walsham forceps. Close reduction means you are not giving a cut on the skin. And then with the finger, you bring the bone back to original position, beta. This is immediate close reduction before edema start using Walsham forceps. But if edema is already there, then you wait for 7 days and then do the fracture reduction, beta. What is the name of forceps? Walsham forceps, beta. Okay, can you see Walsham forceps, beta? Okay, now let's do further. Next is septum fracture, beta. Everybody, next is nasal septum fracture. Nasal septum fracture, it's of two types, beta. Look at me, beta. It's of two types. Look at me, everybody. Nasal septum fracture is of two types. Now, where is the septum, beta? Idhar dekho. Where is the septum? Over here. This is septum, beta. This is septum. Am I clear? Now, the fracture can be of two types. If the force is from front, like this. If force is from like this, beta. Force is, look at me, beta. If the force is from front like this, from front, it will cause horizontal fracture. But if force from below, like this, from below, it will be vertical fracture. From front, horizontal fracture of septum. From below, vertical fracture of septum. So if force is from front, horizontal fracture. And that's also called Zar-Za-Wave fracture. Bolo beta. If force is from front, it will lead to which fracture? Horizontal fracture. What is the name of fracture? Bolo. Speak up. Zar-Za-Wave fracture. And if force is from below, beta, from below, it will lead to vertical fracture, also called as Chevrolet fracture. So, two type of fracture, beta. Force from front, horizontal fracture or Zar-Za-Wave fracture, and force from below, vertical fracture or Chevrolet fracture. Treatment is fracture reduction. Fracture reduction using ASH forceps, beta. ASCH. Fracture reduction using ASH forceps. ASCH. Fracture reduction using ASH for ASCH. Fracture reduction using ASH for ASCH. ASH for. Anybody, what was the name of the forceps for the nasal bone fracture reduction? Was Walsham forceps. Walsham. What is the name of the forceps for the fracture reduction of the septum? For the septum, we have got ASH for ASCH. ASH forceps. Can you see what Walsham forceps, ASH forceps? Walsham forceps are for the nasal bone fracture reduction. ASH forceps are for the septum fracture reduction. Okay, let us go further now. Everybody, let us go further. Next one is zygomatic fracture or tripod fracture. Next topic, beta. Everybody open up now. Everybody go open up. Zygomatic fracture or tripod fracture, beta. Tripod. This is a question, beta. Tripod fracture, zygomatic fracture, tripod fracture. It is the second most commonly fractured bone of face, beta. Everybody, can you tell me what is the most commonly fractured bone of face? Nasal bone. But second common is the zygomatic fracture or tripod fracture? Everybody, can you tell me where is your zygomatic bone, beta? Can you look at everybody touch this area, beta? Everybody, can you touch this? Can you see the white arrow, beta? This is your zygomatic bone, beta. Everybody, zygomatic bone. This is the zygomatic bone. This is the body of zygoma. Okay? This white arrow represents the zygomatic bone now. Now let us look at this bone from the side angle, beta. Let us look this bone from the side angle, everybody. You will see that this patient would be having, this is the body of zygoma. Okay? Please understand, now this bone has got a body, and this bone has got three processes, beta. Now look at me. Number one makes the infraorbital margin. Number two makes the lateral orbital margin, and number three makes the zygomatic arch. You know, side on the side of the arch, beta. So one, infraorbital margin. Two, lateral orbital margin. Three, zygomatic arch. Because this zygomatic bone has got three processes. That is why this is called tripod fracture. Tripod fracture. Okay. Now let me tell you one clinical anatomy thing over here, everybody. Clinical anatomy thing over here. Please see on the screen, beta. Everybody look at the screen. Now what happens? Can you just see there is a foramen over here, beta. This is a foramen over here. This one. Let me enlarge for you. Below the orbit, there is a hole over here, and this foramen is called infraorbital foramen. I'm clear, beta? It's called infraorbital foramen, beta. Okay? Infraorbital foramen. From infraorbital foramen, one nerve comes out, and that is called infraorbital nerve, beta. The foramen is called below the orbit, infraorbital foramen, and the nerve is called infraorbital nerve. Now, first understand it. All of you touch your cheek, this cheek, beta. All of you touch your cheek, and today you learn it. The sensory supply of the skin of the cheek is by infraorbital nerve. The sensory supply of the skin of the cheek is by infraorbital nerve, beta. Now, if any disease damages this nerve, then patient is going to suffer from anesthesia of the cheek, beta. What all diseases can damage this infraorbital nerve? Number one, please see on the screen first of all. If somebody got a zygomatic fracture, don't you think so? Zygoma got fractured, beta. The nerve got cut. Then somebody got maxillary fracture. The maxilla bone get fractured, the nerve is cut. And third thing, important thing, somebody got a cancer, beta. Cancer of this area. The cancer of the maxillary sinus, beta. That is also going to damage the infraorbital nerve, beta. So three things can damage the infraorbital nerve. Number one, the zygomatic fracture. Number two, maxilla fracture. Number three, cancer of the maxillary sinus. All these three things will damage infraorbital nerve, and that leads to anesthesia of cheek. Now you read your notes, beta. Now you read your notes, everybody. Open up the PDF, the workbook, and see, beta. Now, injury to infraorbital nerve is seen in three situations. Label, beta, number one, zygomatic fracture, maxillar fracture, and carcinoma of the maxillary sinus. Okay, write down. Chief complaint: cheek anesthesia. Cheek anesthesia due to injury to infraorbital nerve. Now this is a clinical anatomy based question. This is a clinical anatomy based question. Cheek anesthesia due to injury to infraorbital nerve. Cheek anesthesia, infraorbital nerve. So will you be able to handle this question in the exam, beta, of clinical anatomy? That cheek anesthesia due to injury to which nerve happen? Infraorbital nerve. In three clinical scenarios, it can be asked: zygomatic fracture, maxillar fracture, and the cancer of maxillary sinus, beta. Now, the next question, beta. Most commonly fractured part of mandible is condyle or subcondylar fracture. One question, beta. Most commonly fractured part of mandible is condyle or subcondylar fracture. Condyle or subcondylar fracture, beta. Am I clear, beta? Fine. Okay, just a one-liner question, beta. Okay. Now comes up need PG level topic, but you should know it. Mid-face fracture. Everybody look at the beta. What is the mid-face, beta? This is maxilla. What is the middle part of face? Which bone? Maxilla. First line. Mid-face fracture means fracture of maxilla, beta. Fracture of maxilla. Now, these fracture are of three types. Get used to this word, beta. Bolo mere saath. Leaford 1, Leaford 2, Leaford 3. Everybody, mid-face fracture are fracture of which bone? Maxilla fractures. And these are three types. Leaford 1, bolo beta, which word? Leaford 1, Leaford 2, Leaford 3. Are you speaking when I'm saying it? I want you to hear from your side in the chat box or in message from Telegram or any. Use Telegram today. Let us use it for this group only. If you are not comfortable with the chat box, come over there and tell me, are you speaking when I'm saying you to repeat or not? Give me some visual, evidence that, okay, you are doing the same thing, because at least I am imagining that we are together in room. I'm imagining together that we are in one room. I hope you are imagining that we are together in one room, because that's what I want to release. How powerful this medium can be, I need to understand from you. So help me understand that. Is it really effective tool of teaching? Please share your views on Telegram or wherever. Are you able to really relate that, okay, this is not, this cannot be the live class, I understand. This cannot be face-to-face class, but is it getting close to that? Please share your views on either of these channels, because this will help, me to decide that, okay, how really, how these classes can be, improved further, or how we can do really further things and all that. Are you getting that we are together? Because this is what, it's not a recorded lecture, it is a very live lecture. So are you getting the feel or not is very important for me to learn. Like you want to learn something from me as an ENT, I want to learn from you guys that what is your, in general, how you are really getting this, because for me, teaching is not a profession. For me, teaching or, sharing the knowledge is a passion actually. The passion means that I want to transport my data into your head. It's a very, 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 very clear-cut thing for me. I want to transport my concept into your head actually. That's what I'm trying to interject actually. So please give your feedbacks on that. It's very important. Even I would like to learn from you. Okay. So there are three types of fractures. Speak up with me. Leaford 1, Leaford 2, Leaford 3. Now let us understand Leaford 1, 2, 3 beta. Leaford 1, Leaford 2, Leaford 3 beta. Oh yes, people are writing on, wonderful. People are already writing on this thing. That's very good. Okay, I'll take the question also. Okay. Now everybody look at the screen, beta. Please see. This is your skull. This is my skull, beta. Now please see in the screen, beta, everybody. Leaford 1 is like this, beta. Leaford 1, everybody. This is a Leaford 1. Now read your note, beta. Leaford 1 is called transverse fracture. Transverse fracture. And it passes through along what? Palate, beta. Palate is there. Leaford 1 is transverse fracture. It passes along the palate. So it has two signs, beta. Number one, floating palate, because it is fracturing the palate. So palate start floating. Palate got separated. Floating palate. Number two, ecchymosis on the palate, beta. Number two, ecchymosis on the palate. Ecchymosis means blue color, beta. I hope you know. Ecchymosis means blue color, na? Blue color. When you get trauma, somebody hit you over here, you get a blue color in the morning, beta. That beautiful bruise comes. Bruise. Bruise? What? Somebody hits your face, there's a blue color over here, beta. Okay? Ecchymosis is a blue color, okay, on the palate, and this is called the Guerin sign, beta. This is called Guerin sign, beta. G-U-E-R-I-N. Guerin sign, beta. This is called Guerin sign, beta. Okay? This is called Guerin sign, G-U-E-R-I-N. Blue color on the palate. Ecchymosis means blue color on the palate due to hematoma or trauma. Guerin sign. Leaford 2, everybody look at screen, beta. Leaford 2 is pyramidal fracture, beta. Look at screen, beta. This is Leaford 2, beta. Leaford 2 is this one. Can you see pyramidal fracture? Can you see pyramid? The yellow color is pyramidal, Leaford 2, beta. Okay. Now Leaford 3, please see on the screen. Leaford 3 is very dangerous fracture, beta. It is like this, beta. Leaford 3, the black one. Now Leaford 3 is actually craniofacial disjunction. Cranium means skull cap, facial means lower part of the skull. Craniofacial disjunction. You know why? This fracture went through and through. The whole of the skull cap got separated from the lower part of the face, beta. And craniofacial disjunction. Oh, very dangerous, beta. Now, can you see one thing, beta? Roof of nose is base of brain, beta. This is brain, beta. Brain. And can you see Leaford 2 and Leaford 3 are passing through the roof of nose? Roof of nose is equal to base of the brain also. Now LeFor 2, the yellow one, and LeFor 3, the black one, they are passing through the base of the skull. So in LeFor 2 and LeFor 3, what will happen is, because brain has got what? CSF beta. The CSF will start flowing from the nose beta. The CSF will start flowing from the nose beta. CSF, very risky problem, that if this happens beta, if this happens, what will happen is, from the nose, what will happen? The CSF will start leaking like this beta. Let me show you. Can you see it over here? CSF rhinorrhea beta. CSF rhinorrhea beta. Can you see CSF rhinorrhea? CSF rhinorrhea. The drop by drop by drop, the CSF start coming from the nose. Now read your notes beta. Everybody read your notes. Please see on the notes beta. Now please see, LeFor 2 is called pyramidal fracture. LeFor 3 is called craniofacial disjunction. Now LeFor 2 and LeFor 3 passing through the base of skull. So there is a possibility of, write down, there is a possibility of CSF rhinorrhea. So there is a possibility of CSF rhinorrhea. CSF rhinorrhea. There is a possibility of CSF rhinorrhea. Okay, CSF rhinorrhea, and this is called traumatic CSF leak. This is called traumatic CSF leak beta. Due to trauma, this is called traumatic CSF leak. So LeFor 2 and LeFor 3 can have CSF rhinorrhea, and this type of leak is called traumatic CSF leak beta. Traumatic CSF leak. Can you see this picture beta? Let us revise beta. Mid-face fracture or maxilla fracture are of three types. LeFor 1, LeFor 2, LeFor 3. What is the shape of LeFor 1? Transverse fracture. It passes along the palate. So it gives two signs. Number one, floating palate. Number two, ecchymosis of palate, which is called which sign? Grin sign. LeFor 2 is called pyramidal fracture. Can you see pyramid beta? Pyramidal fracture. And LeFor 3 is craniofacial disjunction. Can you see cranio? The whole thing got separated. This and this got separated beta. These are risky fracture beta. Why? LeFor 2 and LeFor 3 pass through base of skull. So there is a possibility of CSF rhinorrhea. And this CSF rhinorrhea is called traumatic CSF leak beta. Because naak se CSF aana is CSF rhinorrhea, and that called traumatic CSF leak beta. Am I clear beta? Traumatic CSF leak. Now, everybody, let's go forward. Now, one ophthalmology question. One ophthalmology question. Ophthalmology question. Now, write down. Blowout fracture of orbital floor beta. I'm sure you would have done in ophthalmology also. Blowout fracture of orbital floor. Blowout, right on the side beta. Just on the sidebar somewhere write down. You always have one page at the end also of every chapter. You can use that space also. Okay, but side पे लिख लो चाहे. Blowout fracture of orbital floor. Write down cause. Cause is large blunt object striking the globe. Okay. For example, golf ball. Golf ball. Large blunt object striking the globe. For example, golf ball. The typical question of the ophthalmology will be golf ball injury to the orbit beta. Golf ball is a very heavy ball, rounded ball, and just suddenly hits the globe. And which floor gets, which wall get fractured? Floor get fractured beta. So one question is this question beta. MCQ write down. Blowout fracture is fracture of which wall of the orbit? Is the fracture of the floor of the orbit or the inferior wall of the orbit beta. Okay, am I clear beta? First of all, this is clear. Blowout fracture is due to fracture by some large blunt object striking the globe. For example, golf ball. Okay. Now, everybody look at screen beta. Please understand it. Now, this is your orbit beta. This is your globe. Globe beta. Orbit globe beta. Now, please see the screen. And I'm sure you know it, that you have got extraocular muscles. Then you got periorbital fat. Okay. Now, this is the fracture beta. I hope you know, in the maxilla, we have a sinus called maxillary sinus. Maxillary sinus, beta. Now this is the fractured floor of the orbit, beta. Now this, from this fractured floor of the orbit, what happens is the orbital content, they start prolapsing into the maxillary sinus, beta. The orbital content start prolapsing into the maxillary sinus, beta, like this. The orbital content start prolapsing into the blue color is what? Maxillary sinus. Everybody look at this area, beta. Everybody look at this area. Can you see over there? It's appearing as if a drop of tear is about to fall in the on the maxillary sinus. Look at the black arrow. It is appearing as if a drop of tear is about to fall in the maxillary sinus. This finding, when seen on radiology, is called teardrop sign, beta. Teardrop sign, beta. Now, first of all, see and then we write down. Compare it, beta. I would not say anything. You see it, beta. I would not say anything. Let me be out of the picture totally. You are very able people. Let me be away from you. And you see, and where is the teardrop sign being visible, beta? Teardrop sign being visible where, beta? Let me mark it for you, and you ask yourself, were you not seeing in the same area, beta? Is it that difficult to understand? A teardrop, you don't need me, beta, to understand it. I'm out of the picture right now. You know, I'm out of the picture. You can see, oh, teardrop. The floor of the orbit is fractured, and from that fractured part, the orbital content are prolapsing into the maxillary sinus. It's appearing, look at the yellow arrow, it's appearing as if a drop of tear is about to fall in the maxillary sinus, beta. And this is called teardrop sign. Write down now. The CT scan shows teardrop sign. CT scan or X-ray also, beta. CT scan or X-ray shows teardrop sign, beta. CT scan or X-ray shows teardrop sign, beta. Teardrop sign. Ophthalmology question, radiology question. Ophthalmology question is blowout fracture of orbit is fracture of which wall of orbit? Floor of the orbit or the inferior wall of the orbit? What is the mode of injury? Golf ball injury. Radiology shows which sign? Teardrop sign. That's all. That's all, beta. Hai? We can do these things. They're not that difficult, as the books say. Books will tell you a lot of complicated things, but books make things difficult. Who are authors? Authors are the people who make simple things complicated first. That's why the medical books are so horrific sometimes. You know what? Don't feel like reading it actually. You know what? They're so horrific. But you know, if you apply your logic, common sense, I'm not saying everything, but a lot of things are understandable. Certain subjects are very, very heavy. For me, biochemistry is such a big challenge still. When I think about biochemistry, I'm so happy that I'm not going to read biochemistry anymore. For me, it's a challenging subject. It has been, it will remain to be challenging. I don't read biochemistry now, but I remember it's a very challenging subject for me. But you know, a lot of things are clinical, conceptual, understandable also. It's a medicine amalgam of both the things. Let us try to really make sure we understand things, then we memorize things. There are a couple of factual things, we need to memorize them. PSM data has to be memorized actually. Okay? You know that you have to, a lot of data, medicine, you have to understand and then you have to memorize. But oh, flutter, fibrillation, there's a difference. Tachycardia, ventricular tachycardia, okay, that's the ECG. Then you have to first understand it, then memorize it. So 50% of data is like that, understanding followed by memorizing. And second is factual, only memorizing, but memorizing is common thing, beta. If you don't memorize the understanding thing also, this will no use, beta. Understand the data, memorize the data. Factual data, 100% memorize the data. But both the things are memorize the data, memorizing. Revision, revision and revision is the key to success, beta. Key to success, beta. Am I clear, beta? Fine. Okay. Okay, bache. Let us take now the lunch break. The biggest smile on your face, I'm sure, will be, oh wow, thank God. So it's a 45-minute break. We start at 2:30 again. 45-minute break and we start at 2:30 again. Okay? Sure. If you have any question, please write in the chat box or Telegram. The question I asked you, how is this virtual class going on for you? Please share your feedback on the chat box or on the Telegram. See you at 2:30 again.